I'm Meshal Malik, and you're watching Indus Special. Every year, Reporters Without Borders produce a press freedom list, in which they survey about 180 countries and territories. This year, too, the list came out, and the organization stressed on how what is happening now will be pivotal in how things will unfold for the press in the next 10 years. The report, of course, took into account how coronavirus has impacted reporting. Let's discuss more of this. Joining us for this discussion is Matthew Snape, a journalist for the Italian publication Inside Over and an editor for the British think tank Parliament Street. He joins us from Worcestershire. Thank you so much, Mr. Snape, for joining us, and welcome to the show. Now, as I said, this report comes out every year, but this year, given the context, it will, of course, be more different. It will be considering different factors that go into how the journalistic landscape is unfolding. How do you feel like the climate for journalism and press is changing amid coronavirus?
I think it's changed in two ways. So if I look at the UK, for example, I read a lot of posts on social media and I speak to a lot of people, and they say that their trust in the mainstream media has decreased. Like they don't appreciate the way that the BBC and other outlets like Sky News keep trying to compete with each other for the best questions. But then again, I work for Inside Over, which is a startup company in Italy, and our readership has tripled since the coronavirus escalated. So I think what we've seen is, certainly in the UK at least, and in parts of Europe, is a step towards improved trust in online journalists and decreased trust in mainstream media, I guess.
Right. Matthew, so let me ask you this. What do you feel like your organization, saying that it is a startup, is doing differently than these mainstream channels?
What we do differently is that we provide balanced pieces that look at the news from both angles. So, for example, with my latest piece on the coronavirus affecting immigration measures in the US, France and Spain, I'm looking at it from an economic perspective. I'm looking at it from a health perspective as well. We just try and provide a balanced analysis towards every single story. We're not and in comparison to the outlets like the BBC, we're not goading the government with questions and trying to compete with each other with the best questions. We're just trying to make sense of the whole story.
Right, trying to make sense of the whole story. Now, something I feel like has happened quite a lot, and I'm sure you would agree with me too, is the surge in misinformation, especially surrounding this virus, the various myths surrounding it, and even political conversations. There's a lot of misinformation circulating around all of those angles. Now, especially for a new publication that's trying to find its footing. And a journalist, how do you try to move through that, circumvent all this misinformation, and make sure that there is reliability in the information you put out, especially while information that we ourselves are getting is changing constantly?
So I guess what we try and do at Inside Over is we always try and make sure our sources are verified, because obviously we need to create a relationship of trust with our readers. So every time that we use a source, we verify it, we quote it in our articles so that it's valid. We just try and make sure that whatever information we use in our articles is accurate And like, for example, with me, I will always make sure that I do thorough research before I produce an article. And there have been very few instances, if any, where I've been accused of getting things wrong. I mean, I still put my own perspective on, because they are essentially opinion pieces that I write, but I always try and make sure that the news I write is accurate and verified.
Matthew, what I mean to add that is that the information that we're getting as journalists is changing because the situation is developing, and many of the experts themselves don't know what the nature of this virus is exactly. There's still so much that we don't know about. How do we inform viewers while also trying to toe that line between what we don't know and what we do know?
Well, it's a valid point. It's very difficult at the moment because the coronavirus is just one situation where we just can't predict what's going to happen. The news is changing all the time. The origins of the virus are we're learning more and more about it as we go along. It is a really difficult time to verify how accurate any information we receive is. So I guess as journalists, we've just got to respond to what we learn all the time and make sure that we are producing pieces that are based on accurate information that we know at the time, and try and move away from making wild predictions, I guess.
Right.
Like for example, yeah, sorry, you go.
Right. I take your point there. I just want to introduce another guest who's just joined us, Mr. Andrew K.P. Leung, who's a strategist on China at Andrew Leung International Consultants. He joins us from Hong Kong. Thank you so much, Mr. Leung, for joining us, and welcome to the show. Now, as we talk about this index that is released by Reporters Without Borders, we are seeing that there is a very clear correlation between where countries stand in terms of giving freedom to the press and how they've reported on the coronavirus so far. Do you feel like the coronavirus has given authoritarian governments impetus to expand their suppression of voices?
Well, I think that as far as this crisis is concerned, let's face it, the coronavirus is little understood in the beginning. So a lot of people thought it was just a flu, and a lot of people didn't know what it was, and they were just struggling. So while the information was not fully understood or known, it's obvious that some governments, of course China included, felt a little bit uneasy to release the information to avoid scaring the public too much in the beginning, especially when so little is known about the virus. But however, as the virus developed, then the things have changed, and also in China. For example, the whistleblower, the famous whistleblower in China, who died because of the virus, and he was suppressed in the beginning, and now he's being honored by the Beijing, by the Chinese Communist Party as a hero in the fight against the virus. And then you look at another country, the world's most advanced democracy, the United States. And then only about recently, a couple of weeks ago, the US government even clamped down on any kind of unauthorized. Now, underline the word unauthorized. It's got to be authorized by almost by the White House before people, doctors, the frontline doctors, accept an interview. So again, there is a fear that any kind of information is let loose, and you could create a kind of public scares. For example, in
Mr. Leung, I want to jump into that. And now you are, of course, saying that governments across the world are hesitant to release information because they want to avoid that panic. They want to avoid creating unnecessary hysteria. That, of course, is a legitimate concern. But at the same time, how do we draw that distinction between being hesitant in releasing information and blatant suppression of information?
The difference must be that when the full facts are not yet known, and as you said, it's legitimate for the government not to allow any kind of promulgation of partial facts, because partial facts are not the full facts. I mean, even if you swear it's the whole truth and nothing but the truth, but if you've got really partial information, that could be distorting the real picture. Now, but once more facts are known, then obviously it should be in the public domain as far as especially such a public health threat. Obviously, the more information there is, the better. Now, there is also another stance, another kind of dimension. It's a kind of speculation. It is a kind of finger pointing without knowing where this virus originated. Even though, of course, it is spread in Wuhan, everybody knows, and China admitted it. But where the fact that it is spread in Wuhan does not necessarily mean that the virus itself was started in Wuhan. It could be imported somewhere. So I think that the whole world should grasp the situation and really come to.
Right. Mr. Leung, that's a point I do not want to get into at this point in the discussion. Of course, that's an entire discussion on its own self. But Matthew, talking about what Mr. Leung mentioned, the case within China, the case in the United States. Now, transparency is being held as the main point, main factor, and main thing that governments need to ensure during handling this pandemic, so that the viewers know, so that people in their homes know what they're dealing with, so that we actually see the full extent. Have you seen similar patterns over Europe when it comes to governments undermining journalists and media houses from putting out information?
Absolutely. You've only got to look at Hungary to see where that is happening there. Journalists are being arrested or locked up for basically spreading what the government perceives to be misinformation. I think it's very dangerous for the government to determine what is and isn't misinformation, because it can lead to a long-term clampdown on freedom of speech. And that really worries me, especially in Hungary as well, where, according to that report you discussed earlier, it has fallen down that index already in terms of being the most transparent for information.
Right. You're saying that it's very dangerous for governments to decide what is misinformation and what is not. There can be a very real abuse of power there. But at the same time, we know that misinformation is also causing hysteria. It's also causing trouble. It is also putting many lives at risk. So how do we find a middle ground?
I think what we're going to witness right now is a surge in trust for experts. I mean, a lot of people said in the UK during the Brexit debates that we witnessed a damage in our trust towards experts, but I think that's started to surge again. So I think the more we listen to scientific experts who actually know about this, the better. Scientific experts who confirm the facts already. That's why in my own articles I'm careful not to comment on the science behind all this, because I'm not a scientific expert. Right. I just write about topics I'm comfortable with, like the economy. So I think it's got to be information verified by experts. It's very dangerous for people to start spreading on social media that coronavirus is linked to 5G when we don't know that, or David Icke going around spreading his own conspiracy theories about it. But equally, it's a clampdown on freedom of speech if we start stopping the likes of David Icke from spreading his conspiracy theories. We've got to defeat them through debate and facts instead.
Right. Mr. Leung, something that you alluded towards before were these information wars happening between nations as well. When we talk about that happening, how can we amp up coordinated efforts to tackle that? Because a pandemic is a global phenomenon. We're seeing repercussions across the world. No one nation or no one country is isolated in this. Global coordination at this point is imperative. How do we try to amp up that coordination?
Well, as you say, pandemics is a global problem, and virus knows no international boundaries. So obviously, all countries should act together. But unfortunately, life is more complicated than that, because some countries see their national interests threatened, and they are putting a great deal of emphasis on their own national agenda. For example, the rivalry between the United States and China, especially when China seems to have succeeded in containing the virus, and there is a school of thought and say, hey, China cannot contain a virus better than us. Why is that we have, over 700,000 cases, and China's got only, less than 100,000? It must be fake. It must be false. They must be suppressing a lot of information. But I think if you've been to China, you will know that different countries have different methods of dealing with this virus, and some are more successful than the others. So right. I think that sometimes the information, freedom of information, is sometimes mixed together with politics, unfortunately. And of course, also there is the question of fake news, and some sort of pseudo-facts are paraded as facts. Right. So I think we've got to be very, very careful and right. sticking with the real truth and nothing but the truth,
right.
actually.
Right. Mr. Leung, in those questions that people put out, the death tolls and whether countries are suppressing numbers, there is a real fear there, and one that has been amplified recently, just now, in fact, when we hear about figures such as 41, the death rate in places like England and Wales being 41% higher than they were initially reported. Matthew, what more can you tell us about that? Was that misreporting? Was that suppression of facts? Or are we just figuring out what's happening along the way?
I think we're just figuring out what's happening along the way. I mean, a lot of those figures are determined by other factors as well, like caused by other diseases as well. So I think we're just learning this as we're going along, really. So this is a new phenomenon. So I guess everyone who works in the media obviously has to be careful they're reporting the right information and make sure that if they have reported any misinformation, well, it's that media outlet's duty to correct it. So we just need to make sure that as we're going along, we are just reporting on the correct information and verifying it.
Right. Thank you so much, Mr. Snape, for joining us and talking to us. Mr. Andrew Leung, now talking about the climate that's being created right now and the fact that how information is reported and shared will also determine the future of information sharing, at least in the next 10 years. That's what this report says. Do you agree with that?
Well, I think the most important thing is that there's information. Only partial information is information. But only partial information is sometimes dangerous because you do not know the full picture. It's important to understand the full picture. Obviously, as far as this coronavirus is concerned, the full picture is not yet known because there was a lot of things which are known about the virus. There is no vaccine. And then, of course, different people have different kind of resistance to it. So I think there are a lot of things that has to be studied and understood. So I think that when we report the information, first of all, facts need to be checked, and they are facts and not kind of adulterated facts. Secondly, we must put this into a proper context. I think sometimes the people get distorted because the context is missing.
Right, but who checks these facts? That's the essential problem here now. Policies of governments are varying. We're also getting even conflicting medical science coming out. Who checks these facts and determines that these are facts?
I think that we have got to rely on science. I mean, when I say relying on science, it's not any kind of snake oil science, but reputable institutions, reputable scientists or epidemiologists. So that's one side of the picture. The other side is also very important. For example, you mentioned the kind of higher incidence of death or infection in some countries. Now, it's also because of not just medicine, but because of demographics. Certain countries simply have a larger number of older people more susceptible to the disease. So I think that there's one, when I say that the full picture, I do not mean just the full picture in medicine. You've got to take into account demographics. You've got to take into account different countries' policies which have been implemented, the different culture between the different people. Because, for example, the West seems much more resistant to wearing masks in public places compared with countries in Eastern culture, especially China or even Hong Kong, for example. So I think that all these differences have got to be taken into account to arrive at the true picture. And that's very important, rather than just kind of one-size-fits-all kind of simplistic interpretation.
Right. On that point, thank you so much, Mr. Andrew K.P. Leung, for joining us from Hong Kong. We're going to go for a short break, but stay tuned because when we come back, we discuss how Trump's executive order to suspend immigration will impact the community. Stay with us. Welcome back to the show. Now, President Donald Trump on the 21st of April announced a new executive order to halt immigration over Twitter. In true Trump fashion, of course, he later elaborated in a briefing that the order would last for 60 days and then it would be reevaluated. During the pandemic, the response to contain the outbreak has been the closing down of borders by many countries around the world. But what does it really mean to halt immigration? And what does it mean when Trump does it while the United States becomes the epicenter of the outbreak? Let's discuss this further. Joining us for this conversation is Mr. Micheal Kugelman, who's a senior associate for South Asia at the Woodrow Wilson Center. He joins us from Maryland. Also joining us today is Ms. Motley, who's an American international human rights attorney and author of Lawless, a lawyer's unrelenting fight for justice in a war zone. She joins us from New York. Thank you both for joining us and taking out the time to talk to us. Mr. Micheal Kugelman, what do we know so far about this developing story?
Well, I mean, what's interesting, though not surprising, is that this executive order, I think, is going to look somewhat different than the president suggested it would look initially. I mean, his tweet that he put out suggested that there would be a blanket ban on immigration, whereas in fact, so far as we understand things now, and I believe he's meant to sign this executive order later today, it will be a temporary ban on immigration for a 60-day period, but the type of immigration we're talking about is not immigration on the whole. It mainly refers to not granting green cards, which means essentially that it will affect people that want to come to the United States to live, particularly to join family members or things like that. That's very problematic. What it does not appear to include are people that want to come to the United States to work, those that would be coming on work visas. That should not be affected. And I think there's an irony in that, because when President Trump justified this ban on Twitter, he said that he wanted to protect American jobs. And yet it doesn't seem like the executive order is going to prevent people from coming to the United States to work. So it's what I would describe as a typical Trump move. I think that he's trying to sort of shade this in political terms. He wants to try to distract and appease a rank and file that's worried about the economic consequences of the pandemic. And so I think that's what we've got here.
Right. Mr. Kugelman, I'm glad you brought the irony of that. And let's take a listen to what Trump had to say in trying to justify why he feels this order is necessary.
We have a solemn duty to ensure these unemployed Americans regain their jobs and their livelihoods. Therefore, in order to protect American workers, I will be issuing a temporary suspension of immigration into the United States. You heard about that last night. By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad.
So, Mr. Kugelman, will you say now, hearing that, and as you're saying we know more about it, who it's going to impact, who it won't, what really is the point of this? What really is the point of bringing out something like this at this point in time?
I think that it's political. I think that's very clear. President Trump knows that his main supporters are getting restless and are very unhappy about these continued lockdowns, even though there's a very good, compelling reason for it, for public health reasons. Over the weekend, over the last few days, you had a large number of Trump supporters converging on state capitals around the U.S., calling for these lockdowns to be lifted because of a desire to get back to work. So I think that he wanted to make this move and couch it in the terms that he did to protect American jobs for the very reason that I mentioned earlier, to appease and reassure his rank and file. We're, of course, just a few months away from a presidential election, and Trump will face a very difficult fight from Joe Biden. But I just think that the optics of this are so ridiculous, quite frankly. The president said that he wants to protect American jobs, and that's why he's going to make this move. And yet you have, as you well know, so many immigrants in the United States that have been protecting and saving American lives. All of the doctors and those in the medical field that are immigrants have done so much to help Americans and to save their lives during this pandemic. So the optics are really unfortunate, though, but not surprising.
Right. That's an important point. And Ms. Motley, as we're seeing now, this isn't just a move for optics. I mean, as it is, there is also stuff happening on the ground in the United States that is threatening people who are there contributing, especially in the healthcare sector, their existence within the United States, their stay within the United States. Now, especially in relation to the Dreamers and the DACA recipients, what has Trump been doing on ground so far?
With regards to the immigrants, he's further perpetuated his racist agenda against immigration in the U.S. He's still keeping kids in cages, separating them from their families. Within the ICE detention facilities, there have been many reports of how COVID, unfortunately, is running rampant with those that are detained. So I agree with your other guests that this is just a real desperate attempt for Trump to increase his abysmal approval ratings. And the optics on this, it's just remarkable how Trump has this real gift for, being his own worst enemy, especially in a time like this where the country and the world really needs real leadership on how to handle COVID, and he just makes matters worse.
He also cut funding from the DACA students within the United States. Now, all of this seems to be going to appease his main voter base, which is, cracking down on immigrants and who they feel are not American enough, even stronger than before. But will this come and eventually bite back the United States? We know many of these people, many immigrants, as Mr. Kugelman stated, are the ones contributing during this pandemic. And we know that the pandemic is not going to be over anytime soon.
I certainly hope so. I certainly hope that in the November election, that will be a referendum against Trump and all his agenda issues with regards to immigration and so many other poor decisions that he has made. I think, like your other guest is saying, he's trying to change the conversation. He knows that he's done a terrible job and continues to do a terrible job with regards to COVID and the federal government's response to it. And so he's trying to change the conversation and sort of like you said, incite his base to rally for him. But this is a country that's built on immigrants. It is a country where, I hope that in November, people will vote, will go out and vote and will basically, show Trump that his policies can't continue in this country.
Right. Mr. Kugelman, talking about the essential point here that has tried to drill in is protecting American jobs and trying to open up the economy. The CDC chief came out and said that there will most probably be a second wave in autumn. We know that a Johns Hopkins associate professor said that the first wave might last for anywhere between 6 to 12 months. The economy isn't going to resume anytime soon. But where is Trump's plan? Where are Trump's plans headed in terms of trying to open up the economy?
Well, I think part of the problem, and this has been a problem for the extent of the pandemic in the U.S., is that there really is no plan. There is not really a coherent plan from the federal government. Every day you have this coronavirus task force that comes into the White House briefing room and talks about what's going on, but it's never clear if there's consensus within the White House. There's just a lot of dysfunction. So I think this is why we have to look to the state governments, to the governors who have really, in many cases, taken matters into their own hands, including in the state I'm in, Maryland, where you've had a governor that has acted very boldly to secure more testing and things like that. But, clearly a lot of Americans, and I think there may be bipartisan support for this idea, that many Americans are increasingly unhappy with the lockdown. This is a country that really likes to work. It's a capitalist society. People feel uncomfortable about staying home. And since this threat is invisible, the pandemic, I think that makes a lot of people want to open the country up. President Trump knows that. But again, the public health rationale for taking it slow, I think, is overwhelming. So that makes it all the more difficult for not just President Trump, but for state and local officials to figure out how to manage that fine line between keeping people safe and keeping people at work. But indeed, as you say, there's a good chance this pandemic is going to last a lot longer. For that reason, I think we really need to err on the side of caution and try to do whatever is possible to keep people at home while also providing economic relief, and especially to those that need it the most.
Right. Ms. Kim, just one last question to you. Now, while we're talking about what is needed for the economy to open up, which is, of course, testing, experts are claiming that millions of tests in a week need to be conducted in the United States for any chance of that happening, opening up the economy. Let's talk about some of the disadvantaged and marginalized groups and how testing and them having access to healthcare, lack of access actually, has become more apparent and more highlighted during this pandemic?
Well, definitely with regards to the marginalized groups and people that are in country that are working and as they say, illegal people that are here that don't have an immigration status. I believe that if the testing is pushed forward, people are afraid to even go get the testing for fear that they may be detained, that they may be arrested by the federal government. And so, it's really affecting the marginalized populations who are continuing to try to stay in hiding. They're afraid of being sent back to various countries. Because they've seen how this administration has handled immigration in this country and how it continues to perpetuate the idea that immigrants are dangerous when it's a ridiculous notion because we are a country that's built on immigrants. And so it's very concerning, but it's no secret that we need to increase our testing in this country. And I think that part of the problem that people have with regards to being locked down is that there's no real leadership from the top. If there was sort of a plan in terms of how we would reopen the economy, what needs to be done in 10 days, how we'll continue with the testing or how we will test in this country, I think people will be a little bit more comfortable with, following the directives of different states and staying at home. But, as Mr. Kugelman said, this is a capitalist country. And so people like to work and people want to go back to work. And, it's really, really concerning, especially for those that don't qualify for some of the benefits, which are within the marginalized populations.
Right. Thank you so much, Ms. Motley, for joining us and taking out the time to talk to us. Mr. Kugelman, that's an essential point that Ms. Motley brought up, which is many undocumented migrants not coming forth, even if they feel like they've contracted the virus, just because of what the repercussions might be. Now, we've seen the case of Singapore, in which over the past 3 days, we saw a surge in 3,000 cases almost, and that was mainly in cramped up migrant quarters. If that happens in the United States, this virus, this outbreak will not be curtailed. Is the government cognizant of that dimension?
Well, I certainly hope it is. I mean, the top medical experts, including Dr. Anthony Fauci, who's on the White House coronavirus task force, certainly knows this, and one could hope is impressing this idea upon President Trump. But, as myself and Ms. Motley have been noting, there just doesn't appear to be a coherent plan at the top. And this is why I think that we have to hope that the state governments will be empowered to do what they need to do to move forward and keep their constituents and their residents safe and healthy. Of course, the money, the resources need to come from the government in Washington. But I think that you need to look to the state and local officials to be out there front and center, providing assistance, providing reassurance, providing messaging that is accurate, data-driven. This is all one would think things you should take for granted in a democracy, but we're not really getting this from the government in Washington as much as one would hope for. So I think that's what I would emphasize: the need for there to be coordination between the government in Washington and state and local officials. But I think you really would hope that it's the governors and the state governments that take the lead on trying to provide reassurance, services, and keeping people healthy.
Right. Joining us now is Mr. Faiz Rehman, who's a senior analyst and broadcaster joining us from Washington, D.C. Thank you so much, Mr. Rehman, for joining us and taking out the time. Now, as we've been discussing, and we've had this conversation, but I would like your take on it too. It seems like this immigration order by Trump is nothing but a smokescreen of sorts, a political move as always, and there doesn't seem to be any long-term plan in place. Do you agree with that?
Absolutely. Actually, that's exactly how it's happened. He just basically on a whim, he issued a tweet. He just, without any consideration to policy and its implications. And his administration had to scramble on its policy implications. And he wanted to do it yesterday, but it's like already Wednesday, and he's again tweeted this morning that he was going to issue it today. So we are expecting something, but still the details are so sketchy. And you're absolutely right. It's just a smoke screen. He's just making the immigrants a scapegoat out of this crisis. And there is absolutely no need for any economic or health especially the Wall Street Journal, which is a conservative newspaper, came out with a very stinking editorial against his decision. And we're still just waiting for more details on this, executive order.
Right. Mr. Rehman, just talking a little more about what has so far during this pandemic. Now, the first case was detected in January 21st. Since then, we have a long list of things that Trump has said, what he has done, all alluding towards that he has handled the pandemic tremendously well. But we see him cutting out funding from the World Health Organization, taking these different types of moves, trying to make America more isolated. How do you think the United States will emerge from this pandemic?
Well, unfortunately, we have at this time, of a severe and a very critical times, actually. And, so this pandemic is going on, and we have this administration at the helms. So if you go back to his campaign in 2016 and earlier, you will see all these things now coming out of his administration. Basically, he had been promising, he'd been talking about this. So this has more to do with his the previous campaign, his promises that he made in 2016, and now he's facing a great challenge, this year. So it has to do with politics and just politics, nothing else. As I said before, there's absolutely no reason for the administration to come out something against the immigrants. I mean, if you look at the crisis of coronavirus, a lot of American immigrant doctors, nurses, other health workers have been sacrificing their lives. And now they're hearing from the administration, the top guy, that their relatives can get the immigration. Some of their closest friends cannot come to this country to join their efforts against this pandemic because the president has decided to put a ban on their immigration, even though it will be just for 60 days. And then, but again, he said, we'll, after the end of 60-day period, he's going to assess whether it should be extended or not. So, I mean, it's a very scary situation for the immigrants. We just don't know what's going to happen. It's going to make the situation worse here, not just for the immigration, but for the businesses, for the healthcare, and lots of other sectors in the society.
Right. Mr. Kugelman, that is a point that all guests that have come have reiterated. What an important part immigrants are in the American community, and especially in terms of providing assistance in healthcare. Now, talking about the fact that Trump keeps reiterating that everything he's doing is for the American workers, trying to protect them, making sure that they're the ones who get jobs first. Premised on this argument, what do you fear happening in the coming days as the pandemic, of course, we know it will worsen. Many states haven't reached their peak yet, and many people will lose more jobs. What do you fear will happen, the worst case scenario?
Well, I mean, if you really want to think about doomsday scenarios, I think you have to worry about the possibility of frustration boiling over. I mean, we just in the last few weeks alone, more than 20 million Americans filed for unemployment. So if that trend continues, if the pandemic continues, if more and more jobs are lost, then I think you have to fear that, Americans that are frustrated could come out onto the streets and start trying to riot and do looting and things like that. And unfortunately, in a country like America, which is really cherishes its Second Amendment rights, the right to bear arms, you have to worry about some of these rioters being armed. I think that's really a worst case scenario, though not an infeasible scenario. That's if things really get bad, particularly as we get into the summer months, and if the lockdowns are still in place and more and more people are losing jobs. And unfortunately, President Trump himself appeared to proposed that very scenario when several days back he sent several tweets that said, liberate Minnesota, liberate Michigan. In other words, suggesting that people living in states controlled by Democratic governors, I should emphasize, should come out and, and call for the lockdowns to end. And he stated it in a very emphatic way that some perceived as supporting the idea of violent protests. So it's just very messy. I hope it doesn't come to that, but we cannot rule it out as a worst case scenario.
Right. Mr. Faiz, do you agree with Mr. Kugelman's assessment there of what might become the worst case scenario as the numbers of infections continue to rise all over America, and so does the death toll?
Well, first, a shout out to my friend Micheal from the other side of the pound in Virginia. So basically, yes, I do agree with the worst case scenario. And actually, we already seeing some signs of that in the streets here. As Micheal pointed out, President Trump actually encouraged his followers, his base, to come out, in the streets and protest against the ban, against the what you call the stay-home orders of the states. So, even initially, I mean, in the crisis, when during the first days, maybe in January and February, I see some reports that Americans were buying weapons rather than trying to protect themselves from different means. They thought, and they probably foresaw sometimes, that when people would be in the street protecting themselves through weapons, not through through vaccinations and medications. So yes, I mean, it's a very precarious situation here. Lots of anxiety, especially among those who don't have stable and secure jobs. As Micheal pointed out, millions and millions of people have lost jobs already, and on top of it, the system has been so broken. I mean, this has been a great test of our own system and infrastructure. People, right. Millions of people are still waiting for their checks, their stimulus package checks, relief checks. People who are on unemployment, they haven't received their first check yet for a few weeks. So, and small businesses who are trying to get some help, most of the money in the package, more than $350 billion, went to the larger businesses, larger corporations than the small, very deserving businesses. So, as we see this unemployment, the rising death toll, more infections, and then the tragedy is being compounded by the broken infrastructure, the right. system that now we are testing in these horrible and horrific times.
Right. On that point, we're going to have to end the show there. Thank you so much, Mr. Faiz Rehman, for taking out the time and joining us. Mr. Micheal Kugelman for joining us. It was a pleasure having you both on the show. Thank you for watching Indus Special. We will see you again next week with more stories. Till then, goodbye and take care.